Hi, I'm Autumn. I'm going to be your nurse today. Can you give me your name and date of birth?
Yes, it's Garrett Cotton, 12/20/88.
And where are you right now?
I'm in my living room.
Okay, and do you know who the president is?
Yes, Donald Trump.
Okay. Patient is alert and oriented ×3. Skin is dry. I don't notice any diaphoresis or lesions, bandages, drainage, or any tubes. Today I'm going to be doing a head-to-toe assessment on you. I just have 3 more questions to ask. Do you have any allergies?
No.
Are you on any medications?
No.
Okay. Do you have any pain?
No.
Okay. Great. To begin, I want you to just read the block lettering on the badge.
Yes, it's Autumn Cotton, ESN.
Okay. Snellen is 14 out of 14 with the near vision test. Okay, next I am going to get my pen light and look at your eyes. So just look straight ahead. Okay. Pupils are pearla. And then I'm going to have you follow my finger and just follow it with your eyes and with your head. Okay. CNS 2, 4, and 6 are intact. The next thing I'm going to do is have you smile. Puff out your cheeks. Okay. Say ah.
Ah.
Ah, yay.
Ah.
Uvula is midline and rising. Patient can hear as noted by being able to follow my commands. All right. Stick out your tongue and move it side to side. Perfect. I did not do 5 as instructed by the video, but that would be to clench your jaw to check cranial nerve 5. So cranial nerves 2 through 12 are intact. The next thing I'm going to do is feel your carotid pulse on any time. Okay. And I'm going to have you put your hands like this.
Okay.
I'm going to pull and you resist. I'm going to push, resist. Okay, I'm going to push on your jaw and you resist. I'm going to push on your other, resist. I'm going to push down on your shoulders, resist. Okay. Muscle strength noted 5 out of 5 with full resistance. Go ahead and before I listen, I'm going to go ahead and feel down your arm. Skin is dry, warm. Do capillary refill on both ears at the same time, which is less than 2 seconds. And then I'm going to go ahead and listen to your carotid pulse with the bell of my stethoscope. Okay. Take a deep breath. Hold. Okay. That's out. Take a deep breath. Hold. Great. And then I want you to lift your chin just a bit and look off to the side. Nose distension noted. Okay. Now I'm going to move down your and check your brachial pulse. I'm going to check your radial pulses. Before I move down to the bottom part of the body, I want to go ahead and have you sit up.
Okay.
And while the bell of my stethoscope is still on, I'm going to listen to the 5 spots of your heart.
Okay.
Okay? So I'm going to need you to lift your shirt for that. And put it underneath, okay? It's a little cold. Sit normally. 2, 3, 4, 5. Okay, I'm going to flip my stethoscope around to the diaphragm and I'm going to listen to those spots again. 2, 3, 4, 5. Okay. Heart sounds S1 and S2 are clearly heard. No extra sounds noted. Okay, I'm just going to have you sit up one more time and I'm going to check your lungs down, starting with your back. So go ahead and shift your weight that way. Okay. Listen to the 6 sounds on the back. It might be a little bit cold because I'm going to be lifting your shirt a little in the back, okay?
Okay.
Okay, breathe. Okay. 5. Okay, and then hug your arms up to your chest. I'm going to listen to the 2 sounds here. And breathe. Okay, and I'm going to move to the other side. Go ahead. Now I'm going to go ahead and move to the front so you can just sit back and relax. I've removed your shirt. So just take 1, 4, 5, 6, 7, 8. Great. Lungs are clear bilaterally on front, back, and sides. I'm going to move down your body before we get to the abdominal assessment, okay?
Okay.
Okay, so go down this way. Roll your pant legs up just a little bit. Skin is clear. I don't notice any lesions. Trigger is rapid recoil. Checking capillary refill on the toes. Less than 2 seconds. Checking brachial pulses. I'm sorry, checking tibial pulses. My mind's crazy. And pedal pulses. Okay, pulses are +2. Move up your body and check the trigger on your arms. Rapid recoil. And we'll have you flip your feet up onto the couch and lay your head down on the pillow. And then you can lift your shirt. Stomach is rounded, no lesions or drainage noted. And skin is dry and warm with hair appropriate to gender, evenly distributed. And I'm going to go ahead and take a listen. Just like normally, I'm just going to be listening to your 4 quadrants. Okay, now sounds are active in all 4 quadrants. I'm going to start by lightly palpating as much surface area as I can. If you feel any change, let me know.
Okay.
Go ahead and do your palpation. Good, go ahead and sit down.
Okay.
If you need anything, I will leave you with the call bell, and if you need anything, and I can come back and answer the questions you have.
Okay.
Okay, thank you.
Thank you.
Before I started, I took my patient's blood pressure, which was 118/78, and then, which is within normal limits. And I also checked the pulse rate, which was 78.